So here in Texas, especially in February of 2025, we've seen an outbreak emerge for measles. So measles is a highly preventable disease, preventable through vaccination. It's very difficult to prevent transmission of measles without vaccination. And so infection often starts with fever, runny nose, cough, and rash, but there are severe consequences of measles. In fact, in unvaccinated children, what we're seeing in Texas is half of those small kids under 5 are ending up in the hospital. And that has real impacts on the healthcare system, families, and the public health workforce. And we'll see other long-term effects if this continues to grow. If the outbreak continues to spread as it's been spreading now in 9 counties, 124 cases, which again is one of the largest outbreaks that we've seen in recent years, or is on track to become so. I'm Dr. Rebecca Fischer. I'm an associate professor of epidemiology and biostatistics in the School of Public Health at Texas A&M University. Measles is incredibly infectious, and so it's spread through airborne transmission. And so an individual with measles often presents with cough, with stuffy nose or runny nose, sometimes with conjunctivitis, and then later on with a rash. So after an individual is already infected and infectious, the rash develops, and that's usually the indication, the sure indication that you might have measles and should get checked. It's important that the infectious period starts before symptoms might present or before the rash begins. That makes it really important that if you have been notified by the health department or through the media that you may have been exposed to measles, you should seek advice from your local county health department or city health department. So your health department will give you direction on how to get tested, where to be tested, and what isolation instructions you should follow. It's really important not to go to the doctor's office unless you have contacted them in advance, because your mere presence at the doctor's office, if you are infected, can pose a risk to others. Because of the high infectious nature of measles, even being in the same room with somebody who has the measles and is breathing and talking and maybe coughing can pose a risk to your health. So measles is a virus actually that can persist for a little bit in the environment. So what this means is that if that measles virus lands on a tabletop, desktop, pencil, cup, doorknob, that can persist for a little bit and remain infectious. The good news with measles is it's a vaccine-preventable disease. It's highly preventable. That vaccine is considered one of the most effective vaccines that we have in use, up to 99% effective. And what that means is that vaccine, after 2 doses, is preventing 99% of hospitalization and severe illness and death that would otherwise be expected in unvaccinated populations. So the highest risk individuals for infection are those who are unvaccinated. Even with vaccination, a small percentage of individuals, up to 1% to 2%, could experience infection, but we're largely seeing that hospitalization, severe illness, and death are prevented through vaccination. This is really important because in the past, before we had vaccine, almost everybody experienced measles illness. So we've eliminated that in our present day through vaccination. Now, timing of vaccine is really important for measles because our children who are under a year old are not eligible for vaccine against measles. So they're going to be at really high risk of infection if exposed to the measles virus. They're also at the highest risk of illness. In the current outbreak, most affected individuals are children. And in those children under 5, about half are landing in the hospital. Individuals who are adults already and have not received at least those 2 doses of the MMR vaccine, the vaccine that covers measles, should get vaccinated. That may sound like a small number, but considering that most of the cases of measles occur in children, especially in children under 5 years old, even 1 death in 100 children has an enormous impact on the family, the community, the healthcare workers, and the public health professionals that were involved in that patient's care and management. So mortality at 1 or 2% sounds low, but it's huge in terms of its impact. So pregnant women are another high-risk group for measles. So pregnant women are not eligible to receive the MMR vaccine that is in use and recommended for the general public. But pregnant women and their unborn children can suffer infection, and the impacts on the unborn child can be permanent, and it actually include things like death, stillbirth for that child. Other impacts on that child can include long-term deficits in hearing, in cognitive development, and in nutritional development. Because measles is so infectious, experts agree that about 90% vaccination coverage is what's required to keep outbreaks at bay. That's higher than what we might see for something less infectious, such as influenza, where the vaccination coverage might be recommended at only, say, 80%. We've seen those school-aged children, who are the ones who are receiving that second dose to be fully vaccinated. We've seen an increase in vaccine exemptions requested for school-aged children. So we've seen that number, that proportion of school-aged children who are not vaccinated increase threefold in the past decade. That's really important because we have our children who are at risk of measles, including at risk of hospitalization due to measles, and we're failing to protect all of them as well as we could protect them.